day, everyone. Today, we are going to focus on the issue of workplace wellness or corporate wellness. The 3rd to the 7th of July, every year in the South African Health Awareness Calendar is designated Corporate Wellness Week. And so our podcast today is going to be explaining what corporate wellness is. Why should companies have, these programs? Are there any benefits, or these are just, nice to have kind of programs? And also, what benefits companies actually derive from these kind of programs as organizations, but also the employees who work within these organizations. What exactly are the benefits at a personal level? So just stay tuned and, just listen. We will be sharing a lot of information in relation to that. Today, I've got one of my team members, Mr. Sipho Masigo. And he will be firing some questions that are meant to try and extract information and create awareness about the various aspects of corporate wellness.
Good morning, Doc. Good day, good afternoon to all the listeners of the Dr Fundi channel. Doc, thank you so much for having me as your co-pilot this morning.
Thank you very much. It's always easier, when you have a co-pilot. I mean, when they are flying the jets, there's always at least two pilots, so that if anything happens with one, the other one can still, fly the jet safely. And so even in this situation of a podcast, it makes a lot of sense that we have more than one person who are actually driving the conversation.
Absolutely, Doc. I'm excited to speak to you about this. I think, Doc, I've put together a few questions so that you help me understand, and I think all our viewers will learn a lot from this conversation. You mentioned in your opening that the 3rd to the 7th of July, according to the SA Health calendar, that this week has been designated as a Corporate Wellness Week. What is corporate wellness and what are its key pillars, Doc?
Well, corporate wellness, otherwise referred to as workplace employee wellness. These are programs that are implemented at workplace level. These are programs that are paid for by the employer, so they don't cost the employees a cent. These are programs that are of a strategic and operational value to employers. And you asked me what are the pillars of these programs. A proper employee health and wellness programs should have at least about 4 pillars. The first pillar is a pillar that looks at matters of occupational health and safety. That is, employers have got an obligation to ensure that the workplaces are safe and healthy. That is, people do not get to be sick by being at the workplace.
Okay.
So that's the first pillar. The second pillar is around issues of medical incapacity and disability. Meaning, when somebody is sick or when somebody is injured, and they become medically incapacitated. They are then, put on sick leave. And when they are on sick leave, obviously, they cannot contribute to the workplace. And so if that sick absence is prolonged, or if that worsens and it becomes a disability, then it affects the operations of the employer. And so that's the second pillar. Incapacity and disability. The third pillar has to do with diseases that may actually affect employees in the workplace. And, worldwide, we've recently had to deal with COVID-19 as a disease. And that disease had a serious negative impact to employers. But in the past, we've had to deal with HIV and AIDS pandemic, which also had a serious impact, in the workplace. Also, there are non-communicable diseases, hypertension, diabetes, and many other, lifestyle diseases that over time, the complications can actually affect workplaces. So the third pillar is disease management programs in the workplace. And then the fourth pillar has to do with what we call psychosocial interventions. Employees who are not able to do their best in the workplace because at a mental, emotional level, something is troubling them. It could be problems with their relationships. It could be problems with their finances. It could be problems with their colleagues. It could be problems with their managers. But there is something that is troubling them at a mental, emotional level. And so when we look at these corporate wellness programs, at least they must have those four pillars. And even better if those four pillars don't work in silos, but they work in an integrated fashion. And these are things that are done at the workplace to make sure that the health and the wellness of the employees is actually optimized, because we know the saying that healthy employees are productive employees. So if there are health challenges with the employees, you obviously must expect that there will be challenges with their productivity.
Absolutely. So in that regard, Doc, is there any legal obligation for employers to implement the corporate wellness or the workplace wellness program?
Well, I'm going to answer it in a different way.
Okay.
So in some of these pillars, there is a legal obligation. In the other pillars, it's not necessarily a legal obligation, but a moral and ethical obligation.
Okay.
Yeah. So let me start with matters of occupational health and safety. Now, that one, there is a legal obligation. There is an act that is called the Occupational Health and Safety Act, number 85 of 1993, which obliges all employers, public sector, private sector, small companies, big companies, it obliges all of them to ensure that the employees work in an environment that will not endanger their health, and employers are actually even obliged to conduct regular health risk assessments to look at what are the prevailing risks in the workplace, how can those risks be communicated to the employees, what measures can be taken to prevent those kind of problems, and also sometimes there has to be tests that are conducted at a regular at regular intervals. So that's one has got a legal obligation, that is occupational health and safety. So no one can say we cannot do this. It is part of doing business. But even if you're not doing business as an employer in government, you still have to put these in place. But there are other related laws that deal with matters of incapacity and disability. So, for example, the Labor Relations Act, which has got a code of good practice that deals with how matters of incapacity due to ill health or injury must be handled in the workplace. And so employers, as they deal with employees with medical incapacities or even injuries, they must comply in terms of how to deal with those problems. So there's a legislative obligation there as well. Again, when you deal with matters of mental health, again, some aspects are actually regulated again by the Code of Good Practice of the Labor Relations Act. You've got COIDA Act, which is the Compensation for Occupational Injuries and Diseases Act, which regulates how employers must deal with injuries on duty or diseases that people acquire in the course of the work that they do. All right. But there are also other programs or codes of good practice, for example, around sexual harassment and other things that employers must adhere to. And so, yes, there is a legal obligation for the majority of these pillars, but putting programs in place to create awareness, for example, about hypertension, diabetes, cholesterol, and all of that, it may not necessarily be a legal obligation, but it's a moral obligation, because we are in a country where the majority of people are now dying annually from complications of lifestyle or chronic diseases of lifestyle, what other people refer to as non-communicable diseases. So it's important that employers recognize this risk and put in place programs for people to be given information around that, but also to be screened so that they can be picked up early if they've got problems. So it's both a legal compliance issue and also moral or ethical obligation on employers to put these in place.
Doc, now, is it, as you explain this, I'm just trying to understand that so many other employers are already subsidizing medical aid schemes to their staff. Is this maybe not perhaps a bit of a burden for them to invest further in this corporate wellness program?
Well, in our country, it's actually a minority of large blue chip employers that understand that to have these corporate wellness programs or workplace wellness programs, it's actually a strategic and operational, decision. So a number of employers, even large employers, still see matters of corporate wellness as a nice to have, as a tissues and tears kind of thing. They don't see it as something that contributes directly to the bottom line, of the organization. And those kind of employers who think like that are actually depriving their organizations, of a lot of value add from these programs. But most of these large ones who have these programs in place, who are forward-looking, they actually understand that you need to have employees who are in optimal health and wellness to be able to execute their duties, which are both mental and physical. Because if the employees are not at optimal, physical health, emotional health, social health, and spiritual health, those employees may not always be able to deliver as expected for their employers. And then employers will be surprised why there's so many complaints on service delivery, why there's so many injuries on duty, why employees are away from the workplace for prolonged periods, and all of that. So a number of forward-looking companies have now, as part of their talent management strategy or human resource strategy, they understand that employee wellness programs are an integral part of how to manage employees in the workplace. And if you ensure that employee wellness programs interface at every level of the talent management, that is from recruitment, you consider matters of employee health and wellness, at induction level, at training level, at performance level, at maintenance level, all the way up until the employees exit, the employment cycle. Matters of employee health and wellness are critical. So it is very short-sighted of employers not to consider these programs. And unfortunately, they tend to pay the price because they train somebody for many years, spending a lot of money, and somebody gets to be sick and they don't they don't derive returns on investment. So investing in employee or corporate wellness programs is actually a right thing to do for the employers, not only from a legislative point of view, but in terms of ensuring sustainability of their businesses.
So then whose responsibility will this be handled by within a company? Would it be HR who would be responsible for this?
Well, like I've already mentioned that, forward-looking companies see corporate wellness programs as part of the talent management cycle. Yeah, the talent management cycle or employee management cycle, from the time you come into the company all the way to the time you exit, with the hope that the company can extend the time the employee is within the company, to derive maximum value and delay the exit, which can be premature as a result of illness or injury. So it's an HR function.
Okay.
But HR may have to deal with this in collaboration with other units within organizations. For example, risk department, especially on matters of safety, health, and the environment. So risk may have to support HR, but it is something that is dealt with at HR level.
Okay. So do employee wellness programs have strategic and operational benefits to the employer? So what will the employer benefit from having this program?
Well, I've already touched on it, that it is actually a strategic imperative. Yeah. By that, I mean, you want to optimize the value of all the employees you have in your organization. Yeah. For you to improve productivity, which ultimately should translate into improved profitability, it is important that you manage your employees to get the best out of them. And one of the ways of getting the best out of your employees is to ensure that they are in optimal health. How then that helps you strategically is that you've got improved productivity consistently. You've got reduced opportunistic absenteeism, which is sick absenteeism, because some of it is opportunistic. You've got a motivated workforce. You've got less turnover of staff, because when you have a high turnover of staff, either because they are hurtful of your environment or because they are sick and therefore they have to exit, you're losing money that you've invested in training and development of those people. So it is actually a strategic thing. It is a strategic thing, and employees, have to be as healthy as possible. During the time when we were battling HIV and AIDS in South Africa, especially in the early 2000s, where young people were dying in numbers from HIV and AIDS, those companies that are listed in the Johannesburg Stock Exchange, as part of their annual reporting requirements, there was a section called sustainability reporting, where they had to report to the JSE if they've quantified the risk linked to HIV to their businesses. Right. So through actuarial modeling to prevalent studies, but have they actually said how big is the problem? What is the risk to us as a company? Number two, those companies, in addition to understanding the level of risk, they were expected to then say, all right, now that we understand how big the problem was, different sectors had different risk of HIV and AIDS. Transport, businesses, with the truckers going around, they got a higher risk, obviously, because the drivers, when they are in the overnight stops, they get involved in other activities that are not necessarily sanctioned by the employer. All right, but also the second thing is, all right, now that you know the risk, how are you going to create awareness about this risk? To mitigate the risk. Three, what programs are you putting in place, like education, awareness, testing programs, treatment programs, and also how do you accommodate those employees who are on some prolonged sickness, but that will come back at the end. So I'm just giving you an example of one disease, and how JSE listed companies had to report on this as a strategic matter. So one can also say the same thing around COVID-19. Obviously there was no JSE, obligation for companies to report. But if one just uses that example of HIV and AIDS, you will then understand that health issues can actually affect the sustainability of businesses. Hence, they wanted reporting under sustainability reporting. Now, obviously, this is not just for JSE listed companies, but also all companies of all sizes. They have to do this thing to make sure that at a strategic level and also at an operational level, there are employees who are fit and healthy to execute, because they will do so with a smile. They are motivated. They will delight your customers, and as they delight the customers, then you're getting repeat business and even word of mouth that company delivers very well. If it's not a company like a government department, you will be praised for service delivery, which makes our citizens to be happy. So it's not just about profitability, it's also about improvement in service delivery. So the benefits are enormous strategically and also at an operational level.
Those are the benefits to the employer, Doc.
Yes.
What are the benefits to the employee?
So obviously these programs are meant to primarily benefit the employees.
Okay.
And in some instances, some components of these programs are not only for the employees. Remember, we talked about the 4 pillars earlier. The component of psychosocial interventions, or what we call employee assistance programs. Those programs are not only for the employee, but they are for the employee and the immediate family members. So SIPO is an employee of Proactive Health Solutions, and Proactive Health Solutions has got an EAP program, a counseling program that is 24/7, 365. Now that program will benefit SIPO and his immediate family members, meaning his wife, his children, sometimes even the helper, so that if there are problems at 2 a.m., that are stressing, any of the family members, then those family members can call the toll-free number and be assisted by qualified professionals, depending on the problem. Or a child has drank paraffin and it's 2 a.m. and you don't know what to do, and then your wife can pick up a phone and ask for guidance, or go into the online, website linked to the service provider. So the benefits are for both the employee and the employer, but others are only for the employee, like issues of health and safety, safety in the workplace, and disease management and all of that. But at the end of the day, these are programs that are supposed to make a tangible impact to the employees, which is why we always say to labor unions, guys, you need to fight for these programs to be seen as strategic imperatives rather than nice to haves. So at an individual level, you are able to access professional help without using your medical aid at the convenience of your workplace. You will have the understanding of the employer when you are going through some stuff, such that they don't think that maybe you are malingering or you are just being sick, lame, and lazy. So when you have a problem, your line manager will be much more understanding. You could be referred to internal, professionals when there is a problem. Let's say there is a bereavement at home and you are not coping. Then you can be able to access those programs, because seeing an independent psychologist out there per hour, it's anything up to about 1,500. And many employees cannot afford that. And medical aids have got very limited benefits from a psychosocial point of view. So there are a lot of benefits. And I think this is what people underestimate, that if they have these programs in place, it can go a long way towards making their employees healthy. Nowadays, there is a concept that is called, I'm going back to the employer now. There is a concept that's called employee engagement.
Okay.
Yeah, employee engagement. What is it that the employer is doing to engage closely with their employees, so that the employees can have a positive attitude towards the workplace and everything. So you'll see a lot of CEOs now having employee engagement sessions, in different places as a way of motivating their staff. So employee wellness programs or corporate wellness programs contribute to positive employee engagement. And in fact, in some, with the millennials and also the Gen Zs now, when they are choosing who to work for, one of the things that they're no longer thinking like the old type of employees who wanted to work for a company for 30 years.
Yeah.
When they choose an employer to work for, they also look at, does this company have a corporate or employee wellness program? And that might actually decide whether or influence whether they join your company or not. So it is now a very critical program for employers to have, and employees, especially, like I said, the millennials and the Gen Zs, they don't waste time. They demand these things, and they can easily tell you, keep your job.
Yeah.
Because my moral and social agenda doesn't align with what you guys are saying. When you were recruiting me, you promised you 1, 2, 3, 4, 5. Now that I'm inside, I find that you said you've got programs, but when I look at these programs, they are actually just a tick box thing. They are not really impactful. So it's very, very important.
You mentioned earlier on, Doc, that you spoke about labor unions. Are they on board? Are they supportive? Are they backing the wellness of the employees within these corporates?
Now, we come from a history in South Africa where unions, amongst black people were not allowed. That is, unionization of black employees was not allowed. And I mean, this is as recent as the early 80s. Since then to now, unions have, grown across different sectors of South Africa. But it started in the mining sector, manufacturing sector, and spread all around. If you now look at COSATU, the majority of the unions there are actually those that are providing their services to public sector employees. But that does not really matter. So do unions support these programs? The answer is a yes. They support because it is their members who are benefiting directly from the implementation of these programs. And so they support them. But the challenge that they have, that is the unions, is that a number of big employers, they pay lip service to these programs. When there's World AIDS Day, what will happen is that the CEO or the chairman or whoever will stand there and say, our employees are the best assets that we have. But then if you then ask that CEO or chairman or HR director, that's very nice, but how much are you budgeting to actually make sure that these programs are in place? You find that there is hardly any budget for these. So they say one thing, in the public forums, in the workplace forums, but in reality, there's hardly any budget for these programs to be put in place. So the unions definitely support these programs, but what they need to do is to use their bargaining power to ensure that resources are actually put behind these programs, because otherwise you're promising one thing but you are delivering another thing. So I think that is the issue about the unions, and for them, the healthier their members, the more membership fees that they will be able to derive. And if more of their members are losing the jobs because of health challenges, it means the membership fees will go down. So they have a direct interest in ensuring that their members are safe, they are healthy, and can work for as long as possible.
All right, Doc. So my next one is, in your view, currently in 2023, what are the pressing employee wellness challenges that necessitate the implementation of corporate wellness programs?
Look, I've already mentioned that these programs are not nice to haves.
Okay.
When we started, that is our business, when we started about 23 years ago, that was at the height of HIV and AIDS.
This was in 2000.
Yeah, basically we started operating in 2000. A number of organizations or companies that we approached, for business, they still did not see the importance of corporate wellness programs. But it wasn't long before the HIV and AIDS pandemic started, affecting their employees, especially the younger ones, and then, creating problems in terms of work attendance, and also creating problems in terms of payouts through death benefits. Then they started, seeing that these programs are actually, necessary. So to try and answer your question, then, these programs are very, very important to have. They are very, very important to have, because everybody wins if they are implemented, in the right way. Everybody wins. Now, I've taken a long time trying to answer. At this moment, in 2023, there are a couple of health issues that are serious and have got a negative impact to staff complement.
Yeah.
One, it is the issue of mental health. As we sit now in July 2023, the level of mental health issues that leads to mental health disorders is quite high. Prior to COVID, a study done by Professor Lund, from Stellenbosch, they found that 1 in 4 employees in South African workplaces have got a mental health challenge, and including those with mental health disorders.
1 in 4.
1 in 4, that's 25%.
Sure.
That was prior to COVID. And that was also confirmed by another study that was done by the London School of Political Science. So is it London School of, I think, Political Sciences, which also confirmed that amongst about 9 countries that they compared, South Africa had run about a quarter of employees with mental health problems. The big challenge, though, was that these employees, majority of them, 3/4 of these affected employees, were not confident enough to come forward and seek help because they were worrying about, a stigma, and they were worrying about victimization. So we've got a problem of high mental health challenges in the workplace. Now that we are in the post-COVID era, some employers are now reporting, up to 1 in 3, right? That is 33%.
That's a lot.
That's a lot. So out of 3 employees, at least 1 has a mental health challenge, which can be, just a mental health challenge. It has not yet, so it's like stress, it's burnout, but it has not yet graduated to a mental health disorder. But what we've seen though now during COVID then is that those people with pre-existing health challenges, a number of them who were under control went off control. They became uncontrollable and needed more treatment and stuff. So mental health in the workplace is a big challenge. And the program like Employee Wellness Program, the EAP, that is the psychosocial interventions, the counseling services, they address that, right? They address that. But also working closely with the disease management programs, then those people with who are diagnosed with mental health disorders, depression, bipolar, anxiety disorders, post-traumatic stress, they can now be treated optimally. Yeah? So the other leg of these programs. Yeah? So mental health is a big problem. Yeah? So in October, on the 10th of October, is World Corporate Mental Wellness Day.
Okay.
So we will talk about it at that point. The other big problem at this moment is the problem of long COVID. Long COVID, basically, these are people who got infected by the SARS-CoV-2 germ and were diagnosed with COVID-19 disease. Those people, whether they had a mild disease or a moderate to severe disease, they survived, they did not die. But what we then started to see as the medical fraternity is that more than a month since these people were discharged or had the symptoms of COVID-19, these people continued to have symptoms of COVID-19, yeah? Or they developed new symptoms or even long-term complications arising from the fact that they had COVID-19. For example, somebody continues to have a problem where they cannot taste food 6 months after they had COVID. Somebody continues not to be able to smell, anything long after they had COVID. Somebody is breathless, they cannot be able, to breathe properly. Sometimes they still need to have oxygen cylinders to give them oxygen. Others have got chronic cough that is not responding to medicines. Others have got what we call general fatigue. They are just tired. They can't work for more than an hour in a day. And then others have got other problems with blood clotting, which necessitates that they must be on blood thinners for months on end. Others develop psychiatric problems like depression and anxiety, major depression and anxiety. So it's a wide range of problems which were triggered by the fact that they had COVID-19. And, a year after, they still are unable, and one of the serious ones affecting the brain, others, they get epilepsy, that is fits. Others are having problems that we call a brain fog, whereby the brain cannot think clearly. They've got short-term memory problems. So you find that Sipho, who used to be an excellent manager, excellent leader, leading a business unit, all of a sudden, Sipho cannot be able to sit and plan properly. Sipho constantly forgets things, and when there's a requirement for Sipho to contribute to strategic discussions, Sipho is unable to do that. And that is part of long COVID. And so we are now, 3 years since COVID started, And there are people who over a year or even 2 years have not gone back to their previous ability to work. Others cannot even be able to do what we call activities of daily living. You know, that is basic thing like just going to the toilet, feeding themselves, dressing themselves. You know, they can't do that. In the West form, also, these people can no longer be able to even go back to work. And the challenge then for employers is, what do they do? For how long should they wait for this employee to recover? Will they ever recover? Because even the doctors themselves don't know, cannot even give a sense of whether this person will ever recover or not, which creates a problem, because if somebody has been off duty for a year, they are not contributing to your company. At some point, then those people should be boarded on ill health grounds. And you find that somebody is still in their 40s, you know, somebody is still in their 30s, you know, but you've given them relatively sufficient time to recover. And the doctors working as multidisciplinary teams and even working with therapists, they are unable to get this person back to work. So it is the biggest challenge. And a study that was done by NICD, you know, around this matter has found that at least 1 in 10, that is 10% of people who got COVID in South Africa, they've got some form of long-term sequelae or complication from COVID-19 disease. And some of these can actually be a problem. So it is actually a pandemic of its own that is now creating even a bigger burden on the public health system for those who use government services, and also obviously the medical schemes for those who use private medical schemes. It is stretching the limited budgets that we already have. So it is a big problem, and for employers, it creates practical challenges around for how long do we reasonably accommodate and get very little productivity or no productivity at all from this person. At what point do we then decide this person must exit with all the moral and ethical issues that come with, you know, that termination of employment, and for how long? And it has got a negative impact on the economy of the country, and it's something that, unfortunately, you know, the medical world is still grappling with. A lot of research is being done, but the truth is there's no treatment that is, you know, I can give you this tablet, it will reverse all of those problems. So it's a problem that's going to be with us for, you know, the medium to the long term. And it is something that employers must be mindful about, that there are legal obligations around managing incapacity and disability relating to long COVID. And so corporate wellness programs must now deal with this matter as well, coordinate how to assess, you know, the functional ability of the employee, look at prospects of reasonable accommodation, and all of those processes, so that by the time the employer decides, well, we've done what we can, then at least they will have documented processes that show that they were a caring employer. They tried their best. Without these programs, it may not be easy for the employer to actually demonstrate that they tried their best. So when an employee goes to the CCMA and say that was unfair dismissal on account of ill health, they may not be able to prove that they have done all that is necessary to ensure that the employee you know, is taken care of, he has been accommodated, and unfortunately they could not be able to recover sufficiently to be able to add value to the employer.
Absolutely. Doc, I'm told we've got about 15 minutes, and
Yes.
I want to spend a little bit of time on our sponsor for this podcast, Proactive Health Solutions, which is PHS, widely known, is a leading provider of corporate wellness programs in South Africa. Please, can you share some of the key highlights of value added or what you are adding to some of your clients over the years? I just wanted us to spend a little bit of time just talking about what PHS has done for corporate and for government.
Well, representing, I'm putting now that hat
The cap, yeah.
of representing Proactive Health Solutions, Pty Limited. This is a company that was registered in 1999. Started operating at the beginning of 2000. So as we refer to, I'm a 2000. So PHS, is Kili 2000.
You millennial.
Yes, Kili millennial.
Yeah.
And so its behavior, I hope it's not like what we see from the millennials and the Gen Zs.
Yeah.
But on a serious note, though, myself and two other co-founders, together with Old Mutual South Africa, we set up this company, having seen that having medical schemes or medical aids doesn't always address health issues of employees in the workplace. Because employees, they go and see doctors when something has already happened. A disease has already happened, an injury has already happened, and we thought it was important for employers to have programs at the workplace, which, if they are effectively implemented, then they would result in fewer employees having to use their medical aids, or even having to exit employment. So that was the gap that we saw in the market. I thought, let me start with that history.
Okay.
But the appetite of implementing these programs has increased over time since 2000 to now. HIV was a key driver of that. COVID-19 is another key driver. And the other trends, in the country in terms of the lifestyle diseases and stuff, the non-communicable diseases, cancers, and all of that are key drivers of this. So your question was, what value have we added, demonstrably added to organizations? I'll say, to talk to you about what we've added in a 23-year period will be, it will take us a long time to cover that.
An hour is not enough.
But I will just highlight a few things. When South Africa was going to have, host the World Cup in 2010, one of the key things that, FIFA wanted was to make sure that there were enough police on the ground, fit and healthy police on the ground. And at that time, Proactive Health Solutions had just been appointed as a service provider to the South African Police Service, which is the biggest national department in the country. Now, they needed to recruit at least about 15,000 new police prior to 2010. And PHS, Proactive Health Solutions, as part of the other programs that we offer, we were able to deliver fit and healthy young police who got trained, and they were able to provide security of our country on the ground during the World Cup. Now, that to me is one of the highlights, where as an organization, we directly contributed to the safety and security of our country and all of the people who visited our country. That's one. Also, we have been working with various provinces implementing incapacity and disability management programs. In fact, we are still one of the leading companies in the panel that provides incapacity and disability management programs. And so through those interventions, when we started in 2003 with some of the departments, they had very high number of people who were exiting on account of illness, that is, ill health retirement. But through the implementation of these incapacity and disability management programs, through a program called PILIR, that is a policy on incapacity leave and ill health retirement in the public service, we've now been able to reduce the number of people who are exiting on ill health grounds in those provinces that we have worked in. That's a major thing. Fewer people exiting on ill health grounds. But also the abuse or opportunistic use of sick leave benefits by the public servants, which is something that was very rife in the 2000s. There's been a substantial, a reduction in the levels of, sick leave that is opportunistic, Mondays and Fridays, days before public holidays, days after public holidays, But also, on the other hand, costs relating to sick absence. Departments are spending less money now paying for somebody who's sitting at home than they used to before, But also, in terms of demonstrating that they are caring employers. So government departments that we've been working with are now seen as caring employers, because for as long as somebody has got a genuine reason supported by medical reports, they can be at home recuperating for as long as it is necessary for them to recover, which is a benefit that is over and above what the law requires. A normal person should have, in any other normal employer, you are entitled to 30 days of sick leave in a 3-year cycle. That is, if you work 5-day week. You are entitled to 36 days in a 3-year cycle if you work a 6-day week. But in the public service, everyone, gets 36 days of normal sick leave. When you finish that normal sick leave, in other employers, it's unpaid or you use your annual leave. But we have been able to implement this policy on incapacity leave and ill health retirement in the public service. That allows for the employer to demonstrate that it's caring for as long as you are genuinely ill. So that's something that we are very proud of in our 23 years of assisting employers. In the private sector, once again, we've been able to contribute, to the employee health and wellness of a number of employees from small and big companies, financial services companies, mining sector companies, and other manufacturing, companies. We're making strong inroads currently in the mining sector. We're making strong inroads in the financial services. We've partnered with one of the leading, medical aid companies in this country to provide, employee assistance programs. So those are things that, when I look back at the 23 years of our existence, I see we are adding value. Lastly, we have a serious problem of crime in this country. At this moment, we are actually a service provider to the justice cluster, to the employers in the justice cluster. For example, Department of Justice and Correctional Services, the National Prosecuting Authority, the Magistrates Commission, and also the Office of the Chief Justice. If you look at all of those employers, they are in the justice cluster, and those are our current clients. On a day-to-day, whether it is during the day or at night or any time of the day or night, employees of those companies are able to phone and get professional help from our call center that is staffed by counselors who are social workers and also psychologists. So that's the value we are adding. We are making sure that the stress that they get through the work that they do, the vicarious trauma that they are exposed to as they listen to those cases in the courts, the work that they do as investigators, whether it is for NPA or for the other employers within the justice cluster, we are able to provide support to those people, which translates to improvement of the mental health status of the employees of those departments, which translates to better service delivery, so that we can be able to deal with the problems, of what people perceive as the slow wheel of justice in South Africa.
Absolutely. Sure, Doc. It sounds like there's a lot that PHS is doing, and of course, just listening to some of those key strategic government departments that you are busy with, the justice system. I mean, this is the people that we rely on to take care of us when you go to the courts and so on.
Indeed.
And if they are not well, then we are going to have a problem.
The cases are postponed, and all of that, and we then say, you know what, there's no justice in South Africa. So we contribute to the wellness of those judicial officers, what we call magistrates,
yes.
The people who support them, and other members of the broader team that deal with matters of justice. So it gives us a lot of pride that we are contributing in that way. Obviously, having looked at the 23 years of our journey to date, we started by being very big in the public sector, but we are on a drive to increase the size of our cake in the private sector. And so we are continuing to look at those medium-sized companies and large-sized companies that are not implementing or are paying lip service to employee health and wellness. And we're saying, let's partner with them so that we can be able to help them to derive value from these programs, which will translate into strategic and operational benefits for them.
Doc, thank you very much. It's been a very informative session. I think I've enjoyed myself listening, and I've learned a lot, definitely. And just your last parting words. We've got about a minute to close it off, Doc.
Well, I think I've tried to cover as much as possible. All I can say is that matters of employee health and wellness, matters of corporate wellness, are matters that have to do with sustainability of your organizations or businesses. If you turn a blind eye to these programs or think that these are tissues and tears kind of programs, you will not derive maximum value from the employees that you have. And so that's saying that our employees are our most important assets. If you don't have these programs, then you are actually paying lip service to that.
Absolutely. All right, Doc, I guess at this point we are out.
Thank you very much. And it was lovely to share a little bit about something that I'm very familiar with on a day-to-day basis. And I hope that people who are listening will derive value from our conversation.
All right. Thank you very much, Doc.